Some foods may seem very common and are sold in every supermarket, but they can cause severe, even life-threatening allergic reactions if not properly recognized and controlled. More dangerously, the immune system weakens with age, making allergic reactions in older adults more intense, harder to recover from, and sometimes escalate within just a few minutes. This is not just a general warning. Reports from the CDC Centers for Disease Control and Prevention have recorded thousands of emergency room visits each year due to food allergies. And older adults are among the highest risk groups, as they often have underlying conditions such as asthma or heart disease. Taking multiple medications regularly can increase the risk of cross-reactions. Early symptoms are also harder to detect because they may be mistaken for other conditions or ignored. Not to mention, many older adults live alone, don't carry allergy medication, and are unaware of the ingredients in the food they eat, which delays treatment and can lead to serious consequences. So which foods should older adults be especially cautious of or avoid altogether? In today's content, you'll learn about 4 common foods that pose dangerous allergy risks for seniors. Number 1. Peanuts. Among all allergenic foods, peanuts are considered one of the most dangerous, especially for the elderly. What makes peanuts so frightening is not only their high allergenic potential, but also their widespread and often hidden presence in many everyday dishes. Common peanut allergy symptoms. Peanut allergies can appear rapidly, sometimes within seconds or minutes after ingestion. In older adults, the symptoms are easily mistaken for indigestion or mild food poisoning. However, these could be signs of anaphylaxis, a life-threatening medical emergency. Mild symptoms usually start with itching in the mouth, throat, or ears, red skin, rashes, dull stomach pain, or nausea. But if the person begins to have difficulty breathing, chest tightness, swollen lips or eyelids, rapid heartbeat, dizziness, or fainting, call emergency services immediately. These are signs of a severe reaction that can be fatal if not treated promptly. Note: some seniors may only have mild symptoms the first time, but the next exposure could trigger a much more severe response. So never take it lightly. Where are peanuts hiding? Many seniors believe that avoiding peanuts directly is enough. But in reality, peanuts are often hidden in many familiar foods. For instance, candies, including cookies, chocolate bars, or sponge cakes with nut fillings. Asian dishes like stir-fried noodles, spring rolls, dipping sauces, or sauté sauce. Granola or cereal bars. Protein bars or fitness powders. Certain cooking oils extracted from peanuts. And especially nut butters, often labeled vaguely as nut butter or mixed nuts without specifying ingredients. How to prevent peanut allergies in older adults. The first and most important rule is to completely avoid any products containing peanuts. Always read ingredient labels carefully, even for items that seem unrelated, such as sweet sauces, snacks, or supplements. When eating out, inform the staff in advance about your allergy. Number 2. Shellfish, shrimp, crab clams, mussel, scallops. Shellfish such as shrimp, crab clams, and mussels are among the most allergenic foods worldwide. For seniors, this isn't just an irritant. It can trigger anaphylactic shock if not identified and treated quickly. When the elderly react to the proteins in shellfish, their immune systems may overreact, causing dangerous effects such as swelling difficulty, breathing, low blood pressure, and even loss of consciousness. Besides obvious dishes like steamed shrimp, boiled crab, or grilled shellfish, these ingredients appear in many popular foods in both Western and Asian cuisines. Seafood broth is used in soups, noodle dishes like ramen or seafood pho. Fish sauces, XO sauces, or Chinese nok Thai seafood sauces may contain dried shrimp or shellfish extracts. Mixed dishes such as seafood salads, sushi, spring rolls, or shrimp-filled pancakes also carry high risks. Some fried or frozen items like seafood cakes or meatballs may contain minced shrimp or crab, without this being listed clearly in the name. In seniors, allergic reactions may appear within minutes or more, slowly, depending on the individual and how much was consumed. Mild symptoms include itchy skin hives, swollen lips, or a burning sensation in the mouth. In severe cases, symptoms may progress to breathing difficulty, wheezing, chest pain, rapid heartbeat, dizziness, or even fainting. Some individuals may experience severe diarrhea or continuous vomiting. Prevention tips for older adults. Always remember what you are allergic to and avoid it completely. Keep a medical alert card or wear a bracelet noting your allergy. When shopping or eating with others, communicate clearly so they can help you avoid risk. Number 3. Saltwater fish. Fish like tuna mackerel, salmon, and sardines are often praised for their omega-3 content, said to support heart and brain health. However, few people realize that saltwater fish can also be a common allergen among older adults, and their symptoms are often mistaken for indigestion or mild sensitivity. More dangerously, reactions aren't always caused by fish proteins alone, but can also come from natural histamines produced when fish isn't stored correctly, leading to histamine poisoning, often misidentified as a typical food allergy. In reality, saltwater fish are found in many meals: sushi, tuna, salad sandwiches, fish porridge, fish noodle soup, sour fish soup, and everyday dishes like steamed, grilled, or braised fish. In processed foods, saltwater fish may appear in frozen meals, fish cakes, or flavoring extracts. Many omega-3 supplements are made from fish oil, something older adults should be cautious about. Symptoms of fish allergy can appear very quickly after eating: tingling in the mouth, skin rashes, swollen lips or tongue. In more severe cases, difficulty breathing, wheezing, dizziness, nausea, or low blood pressure. For histamine poisoning from spoiled fish, symptoms usually arise within 30 minutes. Facial flushing, hot skin, headaches, rapid heartbeat, diarrhea, or vomiting. How to prevent fish allergies in older adults. Avoid saltwater fish entirely if you have a history of allergic reactions or a sensitive constitution. Do not eat canned or processed fish if the manufacturing date is unclear or the product has been poorly stored. If taking heart medications or having chronic conditions, consult your doctor before using omega-3 supplements. Number 4. Food additives in processed foods. For seniors, healthy eating is a top priority. However, many still consume canned foods, processed meals, or fast food, unaware that these products often contain numerous food additives that can trigger allergies, sensitivities, or even dangerous drug interactions. What's more concerning is that additive allergies often develop silently, easily mistaken for normal aging-related digestion issues, food intolerance, or medication side effects, making them harder and more dangerous to detect. Common culprits include sulfites used to preserve dried fruit, wine, soft drinks, monosodium, glutamate, MSG, flavor enhancer in fast food, instant noodles, canned soups, tartrazine, E102, yellow dye found in baked goods, candy bottled drinks, benzoates, preservatives in soft drinks, ketchup, chili sauces. Older adults with asthma, high blood pressure, or those taking antidepressants need to be extra cautious, as additives can trigger dangerous reactions. Seemingly harmless foods like pickled vegetables, canned soups, deli meats, sausages, soy sauce cookies, breakfast cereals, or boxed juices may contain preservatives, dyes, thickeners, or flavor enhancers. These substances not only trigger allergies, but may worsen underlying conditions: high blood pressure, headaches, dizziness, itchy rashes, wheezing, or chronic digestive issues. Symptoms from food additives may appear immediately or after several hours or days. Common signs include itching rashes, skin hives, dull headaches, nausea, bloating, diarrhea, mild breathing issues, dry cough, rapid heartbeat, a vague sense of anxiety or unease. How to prevent additive-related reactions in older adults. Minimize processed and canned foods. Prioritize fresh, home-cooked meals with clearly known ingredients. Strictly avoid any products that previously caused allergic reactions. If an older adult experiences any symptoms after eating, stop the suspected food immediately. Have them lie down and monitor for 15 to 30 minutes. If symptoms worsen, such as difficulty breathing, facial swelling, wheezing, dizziness, or fainting, call 911 or take them to the nearest hospital. If they have an EpiPen prescribed, use it immediately according to instructions. Inject into the outer thigh as soon as possible. Please share this video with your family and friends, especially seniors, so they can recognize and respond in time. Don't forget to follow the channel to protect our health together. See you next time.